Arthroscopic matrix-based meniscal repair using the GOAT instrumentation. The results at 5 years in the clinical setting have been presented by the Poznan group. First, a diagnostic arthroscopy is performed. The joint has stable ligaments, a good lateral meniscus and lateral joint surfaces. The indications are listed in the 5-year paper and essentially represent complex meniscal tears, as seen here on the medial side. A pie crusting of the MCL has been performed for good visualization. The GOAT delivery clamp holds the chondra guide and allows an easier introduction. First, a gutter is used and the GOAT is inserted down the introduction gutter, and the chondra guide is then positioned over the meniscal tear. The rough surface of the chondra guide is towards the meniscus, the denser surface towards the articular surface. An arthroscopic probe is then used to fine-tune the position of the chondra guide membrane, folding it over the meniscus. Initially, this can be tricky, but is learned very quickly. Once the chondra guide is in position, the arthroscopic introduction gutter is used, and an all-inside suture fixation device is then used in a bumper manner with an over and over suture to secure the chondra guide to the torn meniscus. Here the superior suture is placed and then the inferior suture. Once the needle is withdrawn, a suture pusher is used to snug down the chondra guide, and then the arthroscopic knot pusher cutter is used for the final push and cut. This depends on which devices you are familiar with using. This is then repeated in the anterior portion of the chondra guide, and a bumper suture, superior first and then inferior, using an all-inside device. And then this is snugged down in the same manner. Always be careful of the articular surface and be careful not to over-tighten. Then assessment with an arthroscopic probe is useful, and then one can fine-tune underneath these sutures to reposition the chondra guide membrane. The introduction gutter is again used, and then an all-inside device used, or alternatively inside-outside sutures can be used depending on surgical preference. Here, a horizontal superior mattress technique is used with an all-inside device going through the chondra guide into the meniscus, and then more posteriorly through the chondra guide into the meniscus. This is then snugged down and tensions the superior surface of the chondra guide. Again, caution to the articular surface when snugging this down. Further positioning with the arthroscopic probe in order to determine where the next suture should be placed. For brevity, this is omitted in this technique. Bone marrow is then harvested from the anteromedial portal and then instilled around the chondra guide repair. Thank you for your attention.